All right. So today we're talking about Aetna. Does Aetna cover TMS for depression? So the short answer is yes. And they have a better criteria than Medicare, United, and Blue Cross Blue Shield. I'm talking about Florida, okay? So what is the criteria for Aetna to cover TMS? So obviously the patient has to have severe depression, single or recurrent episode without psychotic features. You know, we've already established those things, and they have to be 18 or older. But they require failure of 2 antidepressants from 2 classes of medications. So basically the patient could have tried one SSRI, let's say Zoloft, and then they did not respond to the treatment, and the doctor switched them to Effexor, for example, and they did not respond to the treatment. And one augmentation, meaning that the doctor added, say, mirtazapine or Remeron to Effexor to augment the effect of it, 2 antidepressants at the same time, or the doctor added Abilify to Effexor to kind of augment the effect of that medication. Now, the key there is that they want the treatment to be for an adequate dose and for an adequate duration, and they specify duration to be 8 weeks. If you remember, for Medicare and United, the duration was 4 weeks for an adequate treatment. They, for United, specify 8 weeks, and they stick by it. So they want that number to be the exact in there. Now, here's a couple of problems with Aetna criteria, and obviously the other thing is psychotherapy, just like any other insurance, okay? So the distinguishing factor that I'm telling you about between insurances is the number of medications. Here is a major flaw in Aetna's criteria for TMS. They do not have a section for intolerance of medications. And I thought initially that maybe that was a typo. They did not include it in the written criteria, but then if you submit, then they would look at it and they were like, hey, intolerance of medication is similar to failure, so two intolerance should be fine. That wasn't the case. And I was like, okay, well, let's try if a patient has 4 intolerance. And we had a patient with multiple intolerance of medications, and they still got declined. So, and then we get peer-to-peer, and I speak with doctors from Aetna, and I explain to them, we are not supposed to do harm. If a patient is having a severe side effect of an antidepressant, how do you want me to do augmentation treatment? Augmentation, by definition, is keeping the medication and adding something to it, right? Once I stop a medication, there is no augmentation. It's a second treatment agent, right? And they were like, well, unfortunately, this is our criteria. Like, I don't care about your criteria. You have to be reasonable. You have to use your mind into, seeing whether the patient should proceed with another treatment option when they cannot tolerate antidepressants. And every other criteria, insurance-wise, does have a section for intolerance. So I think we had 3 patients over the last few months that were similar to this, and it got to a point when I asked to talk with the director for behavioral health, and then they kicked me around and what have you, and then finally I got to somebody who supposedly meets in meetings and decides on criteria and what have you, and that person verbally promised that they're gonna bring it up in the next meeting that they would have, and they would discuss whether to add a section for intolerance or not. And still did not happen. And I still get patients who have intolerance of medications, and they have Aetna, and they could not have TMS that they urgently need. So I don't know what to do. As a doctor, or my hands are tied, because they always claim a bias and secondary gain, for the doctors who are pursuing this. It has to be the patient who needs to advocate for this. So a patient who has intolerance of medications and they don't have this criteria, they would raise it up to the general attorney or to their state attorney level to kind of find if they can get the insurance commissioner to kind of stand up for them and enforce such an insurance company to actually have a section for intolerance of medications, just like Medicare and all other insurance criteria. All right, so the summary for Aetna is failure of 2 antidepressants for an adequate duration that is a little bit longer than other insurances, so it's 8 weeks. Augmentation treatment, and they don't have a section for intolerance. Other than that, obviously major depressive disorder in the current episode, and a trial of psychotherapy. All right, thanks. Disclaimer: although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with American Psychiatric Association. Thank you.